Pharmaceutical company Aspen Pharmacare has warned that its COVID-19 vaccination plant in the Eastern Cape could be forced to shut down after receiving 0 orders for the Aspen-branded COVID-19 vaccine Aspenovax. Aspen executives say the plant may have to terminate its vaccine manufacturing lines and return to producing other pharmaceutical drugs. Now, the facility in Gqeberha was announced as Africa's first COVID-19 vaccination plant aimed at supplying vaccines to the continent. For more on this and a couple of other issues, we are joined by National Health Department spokesperson Foster Mohale. Foster, great to have you. Thanks very, very much for joining us.
Good morning, Leanne, and good morning to the listeners of the viewers of the Morning Live and South African.
So, Foster, before we get into the conversation about this vaccination plant, just 1 or 2 questions with regard to the numbers that we're seeing here in South Africa. So we saw quite a big jump over 9,700 cases reported in a day, and that's on a low base of testing. So what is the Health Department making of this? I know yesterday Dr. Crisp was saying that he doesn't believe this is the 5th wave. He believes this is just a little bit of a blimp. What are you saying right now after these numbers?
Yes, indeed, we as the Department of Health and as the government of the country are very concerned by the rising number of COVID-19 positive cases, especially the latest number of yesterday, as correctly said that yesterday we reported about 9,757 cases, and also equally the number of those who have lost their lives due to COVID-19. We've jumped from just less than 20 to 64. So surely this will be a warning sign to all of us, South Africans, especially for those who are not vaccinated and partly vaccinated, that a bigger problem might be coming. As much as it's too early to confirm that this is the 5th wave, but the signs are clear and obvious that we are heading for a bigger problem, as our scientists have predicted that we might be hit by the 5th wave around this time, which is the winter season, which is associated with flu season. And we remember that most of the flu symptoms are similar to COVID-19 symptoms. So meaning that for those who are not vaccinated or partly vaccinated, once you start experiencing the same symptoms of headache and feverish, you may not be sure whether you are experiencing COVID-19 or flu. So hence we encourage people to say, at least if you are vaccinated, at least you have got less to worry about. At least you know that in terms of COVID, you are protected, then you can deal with the issue of flu.
All right. So I just want to ask you very quickly, and let's put this to rest now, this whole mask thing at schools. There was a lot of confusion yesterday. You saw information coming out that no masks will be worn at schools, both the junior and high schools, no masks. And then suddenly there was an about turn. What happened? Where's the communication going on there?
Yes, indeed, Esther, we correctly retracted that statement around only that line around the issue of face masks. Yes, we had we had some miscommunication internally, but the good thing is that we managed to swiftly own up and correct it so that we clarify all this confusion that has been created by that communication. But the bottom line now is everybody has to comply with wearing the mask, especially in indoor gatherings, including the school children in the classrooms.
Yeah, all right, okay. We'll leave it there, Foster. I could quiz you on that and say that this messaging is not good. It really is not good when you sort of have one message coming and then a retraction of a statement. It just sort of puts a big question mark over all the kind of regulations and people asking a lot of questions. What are these regulations all about if we're retracting the same things in a day? Anyway, that's not why we're actually speaking. We're here to speak about this Gqeberha vaccination plant. Now, this is a big worry because as we have spoken, and the backdrop of this is that we are looking like we're moving into a 5th wave. Cases are growing, and we have this vaccination plant that was established, and it was a huge milestone for South Africa and Africa in general to combat COVID-19. Now we hear this week that not a single order has been placed for Aspenovax. Talk to us. What's happened?
Yes, definitely, as the government and as the country, we're very concerned about the fact that we are not, the vaccine plant is not getting in order, but also we are very happy as the government, as the president has announced during the course of the week that on behalf of the government, we are working together with other African leaders in order to save this Aspen plant by ensuring that the vaccines are used that are produced on the continent, they are used within the continent. But we also remember that this vaccine plant is not only servicing South Africa, but it's also servicing other African countries and other countries in the world which are more close to South Africa instead of keeping their stock all the way from US. But we believe that through the engagement with the Aspen authorities, we'll be able to persuade them to reconsider their decision, to delay implementing that decision, especially as we are heading towards what we the expert anticipated as the fifth wave, and with the rising number of COVID positive cases. So we are closely working with the authorities of Aspen, as the President has said, to ensure that this decision is not immediately implemented.
I know that the President spoke to many of his African counterparts. I think from Rwanda, Paul Kagame, Egyptian President, a Ghanaian President, the Kenyan President, Uhuru Kenyatta, to say, listen, this is just unacceptable. I mean, the levels of vaccination on the continent are astonishingly low. I mean, I'm not sure if it's, I don't know, you can tell me, but I think it's something like, how much of the African continent is actually vaccinated?
And let me start with the country. We've vaccinated around 49% of the target population, and 44% are fully vaccinated. But the bottom line here is that we continue to encourage our people to say, even during these difficult times, you know that currently the vaccine uptake is very low because of several factors, including vaccine hesitancy, and also because of the fact that the current dominant variant, which is Omicron, is less severe, less transmissible. So we want to warn our people, want to encourage our people to say we don't have to wait for the worst situation in order to wake up and run to our vaccination site, so we can protect ourselves now instead of waiting until the last minute. So we need to go to our vaccination sites. And also as the government, we're not waiting for people to come to our vaccination sites, but we're also taking the vaccine closer to the people, so that in order to make sure that it's more convenient for people to get their vaccine instead of them coming to our vaccine site.
Yeah, but just to sort of, I had a quick look here. So basically only 1/6 of adults on the entire African continent are fully vaccinated against COVID-19. I mean, 1/6, that is shocking. And here in South Africa, I mean, you've spoken us through the uptake, and the whole point was that, you know, the West holding on to vaccines, the continent not having access to vaccines. Now we have a plant that is based in South Africa. We have the rights to produce this, and yet nobody is ordering. What does this tell us about the hesitancy around vaccines on the continent? I mean, this has got to tell us something, that perhaps people just don't want to be vaccinated.
Yes, definitely. In fact, the issue of vaccine hesitancy, I'll call it, is a global pandemic. It's a pandemic within a pandemic. It's not only in South Africa. It's not only on the African continent. Hence, you've seen, you've heard, you've read in the media that a number of countries, even on the African continent, have disposed a number of vaccine doses which have expired, which shows that the governments have done everything possible in order to protect their citizens. But unfortunately, because of this pandemic called vaccine hesitancy, so they have to part ways with some of these life-saving treatments. So we are saying to South Africans and other colleagues, other African people, to say, let's save the efforts, the resources of our government. The government has invested in these resources to save our lives and the livelihoods. So let's use this life-saving treatment to protect ourselves so that this doesn't go into loss.
Foster, who was meant to order these vaccines? I mean, obviously, there were discussions in the background before this plant was opened, and obviously we had, one would hope and imagine that with the amount of money that's invested into it, the whole talk around the vaccine, we finally got this going, and yet not a single order has been placed for a vaccine. Surely there were deals in the pipeline even before the plant was working and operating, to know that it actually would start supplying the African continent.
Yes, you remember that, unfortunately, as the executive of Aspen did indicate that one of the reasons why they are not the possible reason that they are not getting orders, that a number of countries, especially on African continent, have been relying on the donations from other countries, from Europe and other parts of the world. So that's why they were reluctant to place the orders. But the other, in terms of South Africa, you remember that by the time this plant was officially opened, the country has already secured enough vaccines from other countries and also through donations. But that does not mean we should not place an order. But as soon as we finish what we have currently, definitely as the government, as the president has said, we are going to make sure that we place orders through from this plant.
But it now seems like there's so much excess of vaccines. I mean, even in South Africa, what is the... I remember at one point there was the talk that we had to actually dispose of so many that had reached their expiry date. And, you know, people were just not taking them. So we had to... How many did we have to get rid of because we couldn't get people to vaccinate? And how many vaccines have we now got available that we probably don't even need to place orders?
Yeah, you know, look, as we announced during the end of March that we had to dispose about 900,000, just below a million doses of vaccines because of they were not being used, people were not coming forward. So during the month of April, we did not have any vaccine that were expiring. But this month, we've got about just about 900,000 doses, which will expire if they're not going to be used by the end of the month. But this is just the number, the total number. So in case they're not going to be used. But obviously, when we take this vaccine to the vaccination side, we start with the ones which are about to expire, but not close to the expiry date, because we care about the lives of our people. We'll never make a mistake of administering vaccine which is about to expire on the bodies of our people. So we are just encouraging our people to say we can save the government, because the government spends a lot of money in these vaccines in order to save our lives and the livelihoods. So let's do the right thing to protect this vaccine by taking this vaccine through our arms.
Do we have any vaccines from Aspenovax? Is this Aspenovax, is this a Johnson & Johnson vaccine that has just been labelled where it was manufactured? What is this vaccine, and is it COVID? I mean, has this already been recognised as an approved COVID-19 vaccine, or is it just the Johnson & Johnson?
Yes, indeed, there was a partnership between the Aspen and Johnson & Johnson. Yes, the vaccine that is produced from Aspen and Gqeberha is a J&J vaccine.
Okay, so that's what it is, and so we are ordering from them. Is that where we are getting our vaccines from, at least, South Africa?
Yes, but as I previously indicated, that the first batches that we received previously, it was all the way from US, or from the US plant, because this plant was not yet open by the time we started placing the first orders. But the last orders, yes, they came from. They're coming from this plant.
All right. So in other words, this is just this was bad timing. I mean, how much was given by government to this plant, to this vaccination plant?
In terms of the quantity?
Yeah, in terms of the money. How much money has been...
I'm not quite sure of the exact money yet, but indeed, as the government, we've been working closely with the Aspen and the J&J when they were setting up this plant.
Yeah, because I know that this was meant to or produce other vaccines, not just a COVID vaccine. But the reality is that it needed to get a time lapse so that now they know how to do the COVID vaccine. They're not getting any orders. And the idea was to produce other vaccines. But the risk is it's going to close down, because if no one orders the COVID vaccine, they're never going to get to the point of making other vaccines. Are there immediate interventions? Let's just try and end it there. Are there immediate interventions to save this, or is there a great possibility that we don't need this and it might as well just be closed down?
Look, our understanding is that they're not necessarily shutting down the plant, but they're shutting down the production of COVID-19 vaccine, because they're still producing other vaccines, as you correctly said, that this is the multi-purpose plant where they're producing a number of health products, not only COVID-19 vaccines. So hence we said that we are closely working with the authorities to see how we can better save the situation.
All right, Foster, let's leave it there for this morning. But thanks for talking to us. Foster Mohale is from the National Department of Health, talking to us firstly about the COVID numbers, about the mask mandates, and then, of course, about this Aspenovax, which is now facing the threat of closing and stopping production of any COVID-19 vaccine because they haven't received a single order. All right, let's leave it there.